Zika virus is dominating the headlines. The World Health Organization has deemed it a global health emergency, and up to 4 million people are expected to become infected this year. Most people who contract the virus never notice any symptoms, and for those that do, the symptoms are relatively minor. But for pregnant women who've contracted the virus, there's a growing concern that Zika is linked to microcephaly, a neurological condition resulting in their newborns having smaller heads and developmental issues. Cases like these have spiked in Brazil since October. And because of that, Zika has put a spotlight on the region's most vulnerable women.
At this moment, we have a typical profile of women affected by the Zika epidemic. They are black and brown, they live in poor cities, and they basically are concentrated in the northeastern of the country. They are absolutely, totally dependent of the state to access health care.
The epicenter of the virus is in Brazil's Pernambuco state, located in the country's poverty-stricken northeast. The mosquitoes that carry Zika thrive in tropical, cramped places with poor sanitation infrastructure. And while the explosion of Zika-linked birth defects has so far only happened in Brazil, the virus is spreading in other places too. Last month, officials in some countries told women to stop getting pregnant altogether.
Is absurd. It's problematic for many reasons. It's very problematic because it assumes that women get pregnant on their own, that there is no man involved in this equation. It also assumes that all the pregnancies are planned.
In Latin America, where Zika is spreading, over half of all pregnancies are unplanned, and almost 1 in 5 are teen pregnancies. In these very religious countries, contraceptives are hard to come by, sex education in schools is controversial, and in some countries, abortions are completely outlawed, even to save the mother's life. So many wonder, how can these governments ask women not to get pregnant when they don't provide the necessary alternatives?
What we need is a state who respects reproductive and sexual rights as human rights. Women in this country are facing a kind of psychological torture, and being pregnant and without having enough information and don't know how to take a decision, an informed decision.
Effects from microcephaly can be mild to severe, from learning disabilities and seizures to the inability to ever walk or talk. Early reports out of Brazil indicate that many of the recent cases are severe and complicated by additional disorders. Activists there are now petitioning the Supreme Court to allow women to choose abortion in cases of microcephaly. In 2012, Brazil did begin allowing abortions in cases of another birth defect called anencephaly, but it took the Supreme Court 8 years to make that decision. And over in Colombia, it appears officials may start allowing exceptions to the strict abortion ban in light of the Zika epidemic. So has Zika finally highlighted the underlying issues of women's reproductive rights in developing countries?